Good afternoon. Thank you for coming to 3 West. Thank you for taking time out of your busy schedules to come here. My name is Cheryl Scotto. I am the charge nurse on 3 West day shift. I have been at Mission Hospital for over 20 years, and I would like to just talk to you today about implementing a new practice for bedside nurse-to-nurse report on 3 West. We would like to introduce the process over a period of about 30 days and evaluate it using our tools, our nursing sensitive indicators, as well as our HCAP scores. So what we did is our clinical nurse leaders and our management team assessed the need for change that would improve the quality of a patient's care. So we reviewed and looked through the data of the HCAP scores, which are here. These are our HCAP scores, which talk about the nursing sensitive indicators, which is patient satisfaction and nurse satisfaction with their jobs. So what we did is we identified areas that actually was able to coordinate together and be able to change one practice and make a difference on 3 different processes. So what we did is we identified that there was an issue with our HCAP scores regarding our patient improvement that felt that the nurse didn't spend enough time with them and she didn't care about their feelings. So this was the identifier of HCAP scores, which was created to survey patients to find out their perspective of how they felt they were treated in the hospital. So it's very important because the HCAP scores are also followed by CMS and other insurance companies. The basis of insurance reimbursement is based on patient satisfaction as well. So what this is our HCAP scores, and what I'd like to show you is that these are very specific, which I did hand out to all of you in administration. The HCAP question was, do you feel that the nurses care about you? The target that we would like is a 31 percentile in the surveyed patients that we have once a month. Right now, we are at 29%, which means the majority of our patients, depending on the people who respond to the surveys, don't feel that the nurses care. So the next survey we checked in was the nursing sensitive indicators, which actually communicates with the nurse's quality of her own job as well as the patient's outcomes. So what it is that the nurses have to be accountable to each other, and they have to feel like that they enjoy their job. It's a patient satisfaction and a nurse satisfaction with their job. So that kind of correlates together as well as the bedside nurses report. And then we have the incremental overtime that we discuss, productivity all the time. We use something called a Chronos timekeeper, which then can identify the nurses that have issues with not being able to get out on a timely manner. Not understanding, which the nurses don't, that just 0.17, which is less than 15 minutes of overtime, adds up to thousands of dollars in 1 year. So our proposal for the Education Council and the Quality Council and the Practice Council to you, administration right now, is to change the bedside nurses report to a face-to-face nurses report. In the past, the nurses printed out their SBAP reports. They got report from the offgoing shift, and then they went about their own way to go see their patients and start their day. The bedside report, face-to-face, actually has the nurses. They use the SBAP tool, which they don't use correctly, and so if they had an education piece where they just understood, which these tools are not new, it's just they actually have the risk factors for DVTs, CODI infections, which Medicare does not pay for. It's considered a preventable disease or preventable infection or incident that occurs in the hospital that shouldn't. So if any of these become a problem for a patient, the reimbursement rate goes down. So it's very important that we communicate that as early as we can in a hospitalization. So inside the report of the SBAP, there is a risk factor that indicates that the patient is high-low factors for these specific incidents. If it is communicated face-to-face with the nurses at shift change and involve the patient, it helps the patient be responsible also for their care and understand that they are at risk. So they are responsible for keeping their sequential TEDs on to prevent any DVTs, which is a blood clot in their legs relating to surgery. If they have a catheter that's put in, they make sure that we know the time that it's been put in and that we are aggressively communicating with physician or following our nurse protocol that we can remove that catheter as soon as possible. Also, the face-to-face gives accountability from shift to shift. We are able to make sure we have a patient identifier, the right band on the patient, the right IV solution, the right information in the IV pump, the right the right surgical sites. The nurse to nurse is able to communicate with each other and have that accountability, which then helps develop patient satisfaction, nurse satisfaction with their job, and the patient feels that we're all on board discussing the plan of care. So what we need from you, from administration, it is not money. It's basically accountability to the nursing staff, a very supportive communication tool to where once we feel that we review the scores in the next 3 months, 1 to 3 months, with like a 3-month period, that the charge nurse is out there and encouraging the staff to do this bedside report, that the report is indicating that there is less hospital-acquired infections, that the patients are satisfied with their care, and the nurses are satisfied with their job. So once we do that, what we'd like to do is then implement it to the house-wide council to change the policy and the actual practice so it's a standard practice, so when people float from different floors, it's the same report that each people are getting, and it's a consistency of care as far as using the standard of care bedside face-to-face report. So along with that, the handout that I gave you guys discusses the barriers that we've discussed with our nursing staff to where we think that we've addressed everything that is a concern for a patient or a nurse, and that we also give you the the YouTube links so that you can see that it takes approximately 5 minutes to give this report, but it makes it completely accurate and very efficient. So thank you for your time. If you have any questions, feel free to email me or my boss, Mary Noakes, on 3 West, the nurse manager. These are the handouts you will see, and you will review the data, which is the HCAP scores, which is regarding your patient satisfaction. Also, the nursing sensitive indicators, which indicates the nursing satisfaction, and also the quality indicators on there that indicate the infection prevention. We also have our incremental overtime that we will be able to communicate with you and show you the difference once we have efficient and effective communication tools for the nurses for bedside shift report. Thank you for your time and have a good day.